introduce myself. I am Danielle Kessinger, and I'm a behavior analyst that works at CA Human Services. And today's training is going to be all about how function of behavior dictates treatment and those specific interventions that you could use hopefully throughout your everyday life and your jobs. So I wanted to quickly go over a little bit of information about our organization. CA Human Services is an amazing nonprofit organization that does things a little bit differently. We work with people with autism and other developmental disabilities, and we help their families really thrive in the community. But we are also focusing on reimagining human service systems. So the systems change often takes a little bit longer, but it can be super transformational. And that's really why we are here and we do what we're doing every day. We're really working towards a future working with the most vulnerable population in Virginia. And that's through every aspect of people's lives and in the community. And we really help people, realize their full potential. And we kind of categorize our work efforts in 3 different areas. So we focus on advocating, enabling, and creating. So I work in the enabling teen effort area where I help certain organizations and their employees when they maybe feel overwhelmed, maybe they have a lack of information on evidence-based interventions. So I work 2 days a week in a school district, and then I also work with Health Planning Region 1 and their mental health clinicians as well. So just a little bit of a background of what I do for the organization. And I see everyone is saying hello in the chat, and that's kind of how we're taking attendance. Thank you for doing that. And I'll kind of periodically check back in the chat. We're still all kind of getting used to Zoom, so bear with me a little bit. So some of the objectives that we're going to go over today, so you'll be able to identify the definition of an evidence-based practice. You'll be able to create and write out specific behavioral definitions in observable and measurable terms. You'll be able to observe ABC data and determine the function of behavior. And the last one, which is what we'll really focus on, is really identifying specific interventions based on those 4 functions of behavior. So those are some of the objectives we're going to go over today. So really starting off, evidence-based practice. So the interventions that researchers have shown to be effective are called evidence-based practice, or sometimes you'll see it as EBPs. So one reason for using evidence-based practice is because by law, teaching practices must be based on evidence, and the effectiveness of applied behavioral analysis which is what the degree I got. So some examples could include antecedent-based interventions, naturalistic interventions, self-management, parent-implemented interventions, social skills training. So all of these are evidence-based practices, and it really does refer to a body of scientific knowledge defined usually by the reference to research methods or designing about different ranges of procedures. And today, we really are going to go over strategies that are all evidence-based interventions, and they will really help guide your decisions about your interventions for your client or client's family or anyone you're working with. So throughout the training, we're going to do something called active responding. So hopefully you guys don't mind reading some of the questions in these slides. And then if you would be kind enough to write in the chat what you think the answer is. This is not graded. It's really just to kind of break up the training a little bit, so you kind of get a break from me talking. So if you wouldn't mind just reading this question and then answering in the chat to the best of your ability. And I'll kind of check the chat as well. Everyone seemed to be getting it. So yeah, the answer is true. Exactly. And if you don't get there, in enough time as I go through it, that's okay too. Okay, moving right along. So we are going to start off talking about behavioral definitions. So say you have talked with the client or the client's family, and you have identified the problem or challenging behavior. You kind of ask yourself, what's next? So just because you picked the behavior you are targeting, that doesn't mean that you have clearly defined it yet. Behavior is supposed to be subjective. So what I view as an instance of behavior might not be the same as what you view when we're working with the same client. So counting one behavior can be tricky. It can be hard to show, one tantrum, one scream, or one meltdown. The behaviors we work with can look extremely different from day to day. So it's really important to know that behavior is anything that a person says or does. A behavior definition is really a statement that specifies what to observe. And by doing this, you really can clearly have that clear communication with everyone involved and really have those consistent observations when working with a client. So behavior definitions continued. When writing a behavior definition, you really want to refer to only those observable characteristics of the behavior. And you want to avoid referencing things like intentions or feelings. You want to try to focus on using very clear and simple language in those definitions. And I wanted to give you a little bit of an appropriate example of some really good behavior definitions just to kind of show you. So say a family is telling you that a client is having really bad disruptive behavior. So you as a professional are continuing to ask them more questions about what that actually looks like. You did some direct observation with the client and you came up with a definition that looks like this. So, and you can see here on the slide. So disruptive behaviors are defined as any occurrence of displacing desks, chairs, objects, or work material from their original location without permission. And another example could be, say a family tells you that their son or daughter kicks and throws things. And you do all the necessary steps to come up with a clearly defined behavior definition. And you come up with, kicking is defined as any occurrence of making contact with any part of another person's body using a foot from 6 inches or more. And it's propelling objects, and that's defined as throwing an object at least 1 foot from their location by any movement of their foot or leg in the direction of another person. So you can kind of see here how specific I got with that behavioral definition. So anyone could come into the environment, read that behavior definition, and know exactly what they're looking for, what they should be taking data on when challenging behaviors occur. It's very, very specific. And so you really, it's observable and it's measurable. So really keeping that in mind. And I wanted to give you some definitions to kind of help make that more clear. And in the practice of applied behavioral analysis, there's something called the dead man's test that we use to determine what is and what is not behavior. And it's kind of goofy, but it does really help when you're trying to determine your behavior definitions. And it's a good, effective way to determine what qualifies as a behavior. So it goes a little something like this. So you ask yourself, can a dead man do it? And if the answer is yes, then it is not behavior. So giving you a little bit of an example, can a dead man not respond when getting called on? Yes. Can a dead man not pay attention to his teacher? Yes. So these wouldn't really be good examples of behavior. But if a dead man cannot do it, then it is a good example of behavior. So examples of this could be, can a dead man get out of his seat during math instruction? No. Can a dead man engage in talking out loud and throwing objects? No. So these are all better examples of that behavior. And it's really important to know that, all behavior happens for a reason. And as we kind of navigate how to manage the challenging behavior, it really should be our goal as professionals to kind of find out that reason. And I always like to mention that it's always kind of good to pay attention to the different setting events that are happening around the challenging behavior. And these could all be kind of affecting the client's everyday life. So some examples of this could be, the dad goes on a business trip. They didn't eat breakfast every day like they usually do. Maybe it's allergy season, lack of sleep, changes in medication, anything like that could kind of be written down in the notes just for different setting events that could occur. And we really don't want to make, sorry, that's the next slide. So that's the dead man's test. And just kind of keeping in mind that that could help you write those really good behavioral definitions. So kind of keeping in mind behavioral definitions continued, we really don't want to make assumptions about why a client is doing what they are doing. They could be bugging their friends or displaying challenging behaviors because the independent work is too hard. And what you are marking as maybe 6 occurrences of a behavior needs to be the exact same as what other people are marking when they are working with a client. And that's how behavioral definitions can really be helpful. So you really want to be careful about accidentally shifting the behavior definitions when you're working with a client for a longer period of time. I know that I've caught myself doing this when working with an individual for a long period of time. So always go back to your behavior definition and really making sure that you're taking the data on exactly what you wrote down. And with it being really well defined and measurable and observable, it will be a lot easier for you. And really what you should do with these behavioral definitions is, share it with like all of the different parties working with the client, print out copies, post it in different rooms, include, teachers, case managers, the speech therapist, OT, PT, there's so many different parties working with our clients and students that, it's really good to really share those behaviors that you're targeting. I did kind of want to mention that it's so important to really, do that because you could be, implementing an intervention. Like one time I was implementing a planned ignoring intervention and I didn't share it with everyone. And the OT walked in and said something like, Johnny, stop yelling, please. And it really kind of threw, all that work I did for the past 4 days kind of away, but it wasn't her fault. It was really my fault for not sharing, my plan with her. So kind of keeping that in mind. Does anyone have any questions so far? Okay. So another fun, active responding for you all. If you wouldn't mind reading this question and then, to the best of your ability, just writing it in the chat. You guys are quick. Yeah, so B. Exactly. I think everyone got it right. Awesome. So hopefully that's a little bit helpful for you, and you can kind of see the difference between, observable and measurable behavior definition, and then one that maybe is not so great. Okay, so very quickly, just mentioning the ABCs and functions of behavior. I know this could be a review for a lot of you, so I'm really not going to spend too much time on this, but it is a slide, of course, that I have to add when we're talking about how function dictates treatment. Um, so we really want to, I wanted to mention that we first really need to look at the environment surrounding the target behavior and why we think the behavior is occurring, or the function, or the why. So this is all because this information will lead to what intervention that we are going to implement. So an individual, they don't just do things like, self-interest behavior simply because they might have a diagnosis. It's really imperative that we figure out why they are doing it. And that's really how we analyze the situation. So having a clear description of the behavior, that behavior definition, understanding what is happening before the behavior occurs. This includes different things in the environment and the behaviors, what other people are within it. So that's called the antecedent. Also, the description of what the behavior actually looks like, the description of what happens after the behavior, or something called the consequence. So things like reprimands, social or verbal praise, physical contact, escape from a situation. Those are all consequences. That's what happens immediately after a behavior. So the identification and the desirable behaviors that a client is engaging in, it's our job to kind of help substitute that challenging behavior for more appropriate behavior. And of course, there's 4 functions of behavior, or why behavior happens. And before we even implement something, we have to figure out that reason. And I kind of like this acronym for the functions. I like to think of it as like seats. So I really remember all of them. So you have your sensory, or sometimes called automatic reinforcement. That's when an individual behaves in a specific way because it feels good to them and it meets a sensory need. You have your escape or avoidance. This is when the behavior occurs to escape a person, a task, or an environment. You have attention-seeking behaviors. So this is when an individual behaves to get attention from people like parents, teachers, siblings, peers, or just other people around them in the environment. And then the last one is tangibles, or access to tangibles. This is when an individual behaves in a certain way in order to get a preferred item or engage in an enjoyable activity for them. Does anyone have any questions? I know that can be a review for a lot of people, but I did want to just take a moment because I know this slide I was going to go over quickly. It's just because I kind of got a feel that everyone, kind of knew the ABCs and the functions of behavior, but I did want to ask very quickly, so I'm not going too quick. Okay, if no one has any questions, I will switch slides. Okay, awesome. So another fun, active responding. So if you wouldn't mind just reading this and then filling it out in the chat. Then I promise we'll get to the specific interventions for the functions. Yeah, it seems like everyone's getting it. So yeah, this would be that sensory or automatic reinforcement. So you can kind of see here that the sensory behaviors are happening in all different environments. And it doesn't really matter if, Abby is in a room full of people or if she's by herself. It's not socially mediated by anyone else. It only feels good to her and only her. So yeah, that would be an example of the reason would be for sensory stimulation or automatic reinforcement. Awesome. Thank you for filling that out. All right, so moving on to going over each function of behavior and some potential interventions that you could use. So before going into these, remember that these are just interventions that are appropriate for the functions, but every plan and behavior plan and intervention implemented really should be individualized, and data should be taken before any intervention is implemented for a client or a student or anyone you're working with. These are just some examples of specific interventions that are tied to the specific functions of behavior. So of course, like not every client that has a behavior that's attention maintained, you would implement these. It really has to be individualized. You have to know the history of the individual, but hopefully this information will help you, grasp how there's a connection between certain interventions and certain functions of behavior. So attention maintained target behaviors really do happen for two reasons. Either the client does not know the appropriate way to ask for attention, or the client knows the right way but really hasn't been successful with it, or the challenging or target behavior was a lot faster and a lot easier for getting that attention what they wanted or needed. So, as professionals in kind of this field, it's really our job to teach them those appropriate ways to get attention and to really shape up their behavior. And I'm not going to get into a lot of detail about shaping, but what I mean when I say this is it's really just involving a client in a new skill, really just one small step at a time. And each new step is reinforced, a new step is taught. So really what I mean is if the client doesn't know an appropriate way or appropriate behavior, we teach them one. And if they do know, but they're just not using it appropriately, we shape it up. So just kind of keeping that in mind and the two reasons why attention maintained behaviors occur. So continuing with the function of attention maintained behaviors and those specific interventions, that could help. And again, I always want to mention all interventions need to be implemented on an individual basis, and data needs to be taken. Observations need to be done before implementing anything. But one of the first interventions that are tied to this function is planned ignoring. So it's really a simple concept, and it's really that the behavior functions to get attention. So we want to not give the client attention, essentially. So really be explicit with your staff that you're working with when implementing this intervention. If one staff member provides attention, it really can ruin your chances of seeing any decrease in challenging behaviors. Consider letting people like, the lunchroom workers, the case managers, social workers, anyone like that know that you are implementing this planned ignoring intervention. It really is, whoever might possibly walk into the room and interact with that individual. And this intervention can be super effective, but I do kind of want to mention that before using it, it's good to know that when a response no longer functions to gain that attention, there might be a temporary increase in challenging behaviors or even aggression. I don't know if you've ever heard of the example of the elevator button not working, but say you're at an elevator, you press it once, you press it again, it's still not working. You jam on that button thinking, somehow the amount of times that you're pushing it will make it work. But it's the same with planned ignoring. The behavior is going to likely get worse immediately, and then you'll kind of start to see a decrease in challenging behavior. The next intervention that is tied to attention maintained behaviors is something called non-contingent reinforcement, or sometimes you'll see it called NCR. This is a great one that really can be tied to this. It's a response-independent schedule of reinforcement. And this means the client's responses or behaviors are not dependent or contingent on anything. So you would just give that student or client the reinforcer based on time. So an example could be every 10 minutes, not contingent on any behavior that they're doing, you are giving that student or client attention. You can do this on a fixed time schedule, so every 15 minutes, very strict, or maybe a variable time schedule. So on average, every 15 minutes, we're giving that student or client attention. So an example of this is, in a classroom, this could look like stopping by a student's desk every few minutes to see if they need help, having scheduled teacher time with a student to give teacher attention to the student, scheduling peer breaks or providing, peer attention on maybe a variable time schedule. I've used a timer system where I just, set a timer on my iPhone, and that's the interval. And at every interval, I go and provide attention to that student, no matter if challenging behavior occurred or not. The next intervention that's tied to attention maintained behaviors is timeout. So this could be an appropriate punishment procedure for attention-seeking behaviors because it does remove attention. Timeout doesn't need to be in a corner or a hallway. It's really just, any time taken when attention is taken away. It can be brief. If attention is really a powerful reinforcer, which, for this function it is, it can work pretty quickly. And you don't necessarily have to do something where they're completely taken out of the environment, or sometimes you'll see it called non-exclusionary and exclusionary. So non-exclusionary just means when the client is not removed from the space. So some examples of this is planned ignoring, just maybe looking away from the client, taking something preferred away. Individual is kind of maybe repositioned in the room. So maybe they're not able to observe things going, or maybe they are able to observe things going on, but they're not able to participate. This non-exclusionary timeout, it is preferred because it's less restrictive than the exclusionary where the client is removed from the space. So that example is a timeout room or a partition timeout. So, when the view is restricted, maybe by a wall or a barrier or something like that. The hallway is exactly what it sounds like for exclusionary. It would just be when the client goes in the hallway. I always like to mention that if you are going to implement, a timeout, just make sure that the time in environment has a ton of reinforcement, just because we like to not only use punishment procedures. So hopefully that kind of gives you, 3 pretty set interventions that can be tied to this function. Does anyone have any questions? Someone said planned ignoring has never worked for me. Guess I have a hard time getting past the elevator button response. You like the non-contingent attention best. Yeah, planned ignoring can be very tough. I think especially for us, we work with so many different people. Sometimes it can feel just overwhelming to try to explain it to everyone. The clients and students we work with, I feel like, are in so many different environments. But hopefully if you can kind of control that environment or tweak the environment a little bit, it could be easier. But I definitely understand where you're coming from. I do like non-contingent as well. It's a nice intervention that can work smoothly. anyone, I'm going to move on if no one else has any questions. So the next function would be escape or avoid. So the first one is implementing access to breaks. So before we consider doing this strategy for the escape behavior, you really need to make sure that you're using regular scheduled breaks, but it has to be understood by the client or student. And also deciding how often you should provide the client or student with breaks. So it's really important to know that we shouldn't just pick a number out of the blue. The data that you're taking and you figuring out how often the challenging behavior is occurring should really help with that. So remember that your definition for your target behavior, you should use that with your team and take data and find out how often behavior is occurring. So, is the challenging behavior occurring every 5 minutes, every 10 minutes? So whatever that number is, you really do want to provide a break just less than that. So say the target behavior maybe happened on average of every 12 minutes. You should put a break in their schedule maybe at every 10 minutes. And it might seem like you're not getting any work done at first, but I would say that's okay. You can slowly, fade the workload up over time, but you probably wouldn't be getting any work done anyway if challenging behavior was occurring all the time. So kind of keeping that in mind, that how often your challenging behavior is occurring with your client should be how you choose how often breaks should be implemented, if that makes sense. Another intervention that is tied to this function is task adjustment. So there's so many different little ways that you can adjust your work demands for a client. You can tweak the client's environment and make the work demands you are placing, less aversive to them. And this could really help the environment, be something that the client no longer wants to escape or avoid. And there's a lot of different ways you can do this, and it's really good to get really creative as well. So you can first, make tasks easier. So determine if tasks are too hard for the client. Can they simply just not do them? And this one is all about, reducing the challenge for our clients. The next one you could do is, shorter work sessions. This is all about including more work sessions, just shorter ones. An example of this could be instead of 25-minute work sessions with maybe like a 7-minute break, you could do 10-minute work sessions with a 3-minute break. You will see that maybe you're getting more work done, but hopefully they aren't spending too much time on challenging behaviors, kind of what I mentioned before. Another one is task presentation. Look at how quickly you're presenting the work or demand. I know I have caught myself being so quick with my demands and trying to fit everything in such a short time with a client that it's very overwhelming for them. Try to fit in processing time for our clients after we place a work demand on them. Task choice is another one. So many of our clients, they really like to call the shots on their day. And I can't really blame this for them. I like to be in charge of my time as well. And I hate if everything was picked for me. So this is just a simple one of, allowing them the choices. So you almost like overload them with choices. Do you want to sit here or there? Do you want to use a pen or pencil? Do you want to do reading or math first? Do you want to, do this worksheet or this worksheet first? You really, they should be in control. And sometimes they're so in control with their choices, like how we're giving them, they maybe don't even realize, the work that they're doing or complying to. Demand fading is another one. Sometimes we just want our clients to start slowly complying with requests. Start very small and strategically just increase those demands. So, say you first provide reinforcement for checking a schedule. And then the next day you provide reinforcement for sitting at a table for 2 minutes. The next day you provide reinforcement for opening the binder. And then the next day you provide reinforcement for completing the first page. So, just kind of keeping in mind that there's a very systematic way of, implementing demands. And then the last one could just be breaks slash like less work based on the work completion. So, when specific tasks are completed with this strategy, you will provide breaks for less work. So for escape function, the exact reinforcer is getting out of work. So this strategy is really all about using that as an exact reinforcer. I'm gonna look at the chat really quick. The power of choice is great. Agreed, student like to have choice, definitely. Yeah, and they sound like such simple, adjustments, but they can really make a difference in a client's day. And it really can decrease those challenging behaviors if we're implementing some of these strategies, especially when that function, is lined up with that intervention we're implementing. Exactly. Yeah, everyone likes control for sure. And they, deserve some of that control. Especially, their days are hard. So I always keep that in mind, definitely. And if I'm, going too fast, it's so hard to know on Zoom. I can, at the end of the training, always go back to different slides. And I know we send out the presentation as well. This slide is just to kind of inform everyone what does not work for escape behaviors. I always like to mention this, that timeout doesn't work for escape behaviors. You don't want to have a break right after a challenging behavior. Visuals can help allow the student or client to understand this. They make a choice. Just visuals can really help make that connection. Okay. So if you guys wouldn't mind reading this and then just writing it in the chat. You can get a break from me talking. Yeah, it seems like everyone is doing all the above. Exactly. Yep. Perfect. So there is another active responding. Hopefully I'm not confusing you guys. But if you wouldn't mind reading this one and then typing in the chat. If you're not doing it quick enough, that's totally okay. Looks like everyone's getting this one too. Yep, true. Yep, everyone got it. Thank you. Okay, so moving right along to the function of behavior, This one is access to a tangible or preferred item. Um, there's a lot of different ways you can do this one. You could schedule a moderately preferred activity between a highly preferred and a highly non-preferred activity, and it can really work well. Um, you want to make sure to withhold items or objects following a challenging behavior, though. We don't want to accidentally reinforce the challenging behavior, so kind of keeping that in mind. Um, we also want to teach our clients and students how to appropriately request the items that they like. So, kind of going back to what I talked about with attention. This could be working with visuals at first, where they only have to just point to an object. Um, Also reinforce when a client requests the tangible and appropriate way instead of displaying challenging behavior. I always have to keep in mind this where, if a client displays challenging behavior because they love the bouncy ball and it happens every day, and then all of a sudden, they point to the bouncy ball and it's indicating that they want it, I really want to allow them the bouncy ball because I want to reinforce their appropriate behavior for, asking what they want or need. Another strategy you can use is increasing non-contingent access to tangibles that they prefer. So kind of like that NCR, non-contingent reinforcement for attention, this can also be used for tangibles. Making preferred items more frequently accessible. So if practical, consider non-contingent reinforcement, providing the preferred item or activity, maybe on a time-based schedule, independent of the problem behavior. And hopefully you would see a decrease in challenging behaviors. Now, of course, with non-contingent reinforcement, this might accidentally reinforce the challenging behavior sometimes. And that is one disadvantage to be aware of, but I still very much like this strategy. A lot of people use it over a longer period of time and really do see a decrease in challenging behavior. Hopefully this all kind of makes sense for an access to tangibles. So another function, of course, the fourth function of behavior is automatic reinforcement or that sensory stimulation. Um, this is when the behaviors are, again, not socially mediated by anyone else but the client. It only feels good to them. So using sensory as a reinforcer. These behaviors are very, very reinforcing for your client already. So letting your client work for engaging in that particular behavior can be a good thing, of course, as long as it is safe. I know some sensory behaviors can be unsafe, so always keeping that in mind. Teaching our clients when it is appropriate to engage in the behavior and when it is not appropriate. I have had clients in the past where they've worked for things like tearing paper, playing with Play-Doh, talking time or scripting time. I've done that, definitely. You can also have a sensory spot or, whatever environment you are in with your client. This would be the designated spot for that specific sensory behavior that they're displaying. This can be a certain chair, corner of the room, or even just part of the carpet. I've even done before. And again, the behavior, it shouldn't be dangerous. So, keeping that in mind again. And I always like to remind myself that, we all do sensory behaviors. I constantly twirl my hair. I twirl my hair in my car, during work meetings, which isn't professional, while I'm watching TV. So for me, that's a sensory behavior. Other people, bite their nails, grind their teeth, crack their knuckles, on and on I could go. So not all of these behaviors are bad, but we do want to keep in mind that our clients just tend to have maybe more extreme versions of these sensory behaviors. And sometimes it's very hard and difficult to terminate those behaviors. So we should rather maybe just try to decrease them and teach them to maybe just, discriminate on whether the behavior is appropriate in certain environments. So I always like to just kind of keep that in mind. And, it all goes back to, that sense of control, them having, control over their day and, certain parts of their environment, which is, what they deserve. So, just keeping that in mind. I had another slide for automatic reinforcement for some additional strategies that could be used for this function. One that I've had great success with is reinforcing and reinforcing intervals without behavior. So this is a really good intervention for maybe really disruptive or dangerous sensory behaviors. We want to provide a high magnitude of reinforcement for time intervals without the behavior. So it needs to be a very, highly motivated reinforcer for this to work. So our clients are, they're not going to reduce a behavior that they have had a super long history with, that is really reinforcing to them just for maybe a goldfish or two. It has to be a powerful reinforcer with the interval you are using. So, using a timer that is really helpful, or using a timer is really helpful for this one. Explaining the expectations to them where they fully understand what is going on. So an example of this could be you are targeting, say, a scripting behavior, where they just script, out loud. You're starting the interval maybe just at 2 minutes because that is the amount where they could be successful at, and that's kind of what the data shows. So, after that 2 minutes and no scripting behavior has occurred, they get a prize. And you could, say something like, wow, you graduated to 4 minutes next, or, wow, look, the timer's going off. You didn't script. Now you get this. And now you're graduating to 4 minutes. And you just systematically, gradually increase the time that the client, becomes successful with those time intervals. I really like this one. It's definitely in a classroom too. I've used this. And really just enriching the environment. So, working on increasing those social interactions in the natural environment, increasing access to, preferred sensory materials throughout their day that's appropriate for their age or their, developmental, age group. Teaching, alternative behaviors, allowing them to gain new skills in their, repertoire that they could use. We're constantly, focusing on just teaching them different ways to appropriately ask what they need or want. Is always important to keep in mind for all the functions, but especially, the sensory ones as well. Does anyone have any questions with those? I know with automatic reinforcement or that sensory stimulation function, it's really hard to compete with that feeling. It's hard when something, feels good to you and only you. It's really hard to compete with that and to find a reinforcer that is competing with that level of, sensory feeling. So keep in mind that when you're focusing on this one, it can be a little frustrating because it is hard to find a reinforcer that's competing. But, getting just really creative, trying a lot of different things, really focusing on, your direct observations and different things they play with throughout the day. Maybe they spend time with one activity more than the others. I notice that direct observations is really helpful for this one, where maybe I just sit back for an hour during my day if that's even, possible. I know we're all very busy helping our, coworkers, but sitting back and just observing the client and what they go to can be really telling. I work with hospital-seeking clients. Any advice for this behavior? So they're seeking access to the hospital, I'm assuming. This can be very difficult, I know, when they want to be, Yeah, when they want, that admission in a hospital. It would probably be up to the hospital staff to make the environment, not dangerous, but just less appealing to them, where maybe they're not getting access to other peers in the hospital. It depends on what they like in that environment. So, like I said, that direct observation, really knowing, what their schedule and what their day looks like when they are being admitted into the hospital, and making it almost like, I want to use the word aversive, but not, of course, in a dangerous way or anything, but almost making the hospital aversive to them, where they're not gaining any reinforcement in a hospital. But I would have to, of course, do that direct observation and talk to the hospital staff, and maybe giving them different questionnaires to fill out so we get more information. And, having them, implement some of these interventions that are tied with the function of behavior. It's probably not very helpful, but that can be really difficult. Yeah, I've come across this as well. Okay, so another fun active responding. I'll give you a second to type in the chat. Yep, true. Okay, and I'm going to go on to the second active responding. You guys should get this one too. Yep. So this one is, yep, all of the above. Exactly. I think those are your last active respondings. Awesome. So I did just kind of want to quickly end off about that. It's important to kind of mention that target behavior can have multiple reasons for, why it's happening, or multiple functions. So examples of this are, it's attention maintained behavior, and they are also avoiding work demands. Another example is, the client bites himself and it allowed him to immediately stop doing the work. So that sensory stimulation while avoiding or escaping work. And really just some general tips for this is, just re-examine the data that your team has been taking. And this could just give you answers to which function is occurring under certain occurrences. It also just helps you relook at the environment. So the time of day the behaviors are occurring, the presence of certain people or peers. It gives you a better idea on, maybe an educated guess on when the behavior has each function. And then just really having a plan when to change the interventions based on when you think the function is changing. So almost making like an overly detailed behavior plan can really help here. The key here is to have everyone just following the plan consistently. I've seen success in things like flow charts, where the behavior plan just looks like a flow chart. That's, just easy to follow for everyone. I also want to mention just reinforcement, how important it is to remember that, reinforcement is something that will increase future behaviors. And once you have identified the client's reinforcement, use that to increase behaviors that you want to see more of. So you really want to, create that connection for your client. So they should be able to think like, I do this behavior, something awesome happens or something really good happens that I like. And the reinforcement is given to them. So really creating that connection for them can really do, wonders for all types of functions. So I really just wanted to kind of end off on that note about reinforcement. Identifying the reinforcer is sometimes the hardest part. Absolutely. I know there's a lot of different assessments out there and questionnaires, if your client is able to fill something like that out. I know there's something called, I think it's the Duncan inventory. There's also different ways to directly observe a client in their natural environment. And then, even just having them sit at a table and you giving them 3 types of reinforcers and then seeing which one of them they choose. So there's a lot of different, strategies to use to identify reinforcement, but it's very, sometimes it's difficult. Many of mine are older, but very low cognitively. Yeah, so it's really just finding, where they are and what they can understand. And then from there, implementing those strategies on how to find what is reinforcing to them. And sometimes it's changing up reinforcer, every single day, so they're not getting so, kind of sick of the reinforcer. But that can be difficult. Does anyone have any last minute questions? This is my last slide. Choice preference assessments are great. Absolutely, yeah. Like I said, I can always go back to certain slides, but we will be sending, if you request the presentation, we can send that to you. Someone said that's a great idea. Play-Doh or goldfish. Yeah, if that's reinforcing to them. Some people are not so, they don't love edibles. I tend to not mind them if it allows my client to not display, really challenging behaviors that have been happening for a long time. But I definitely understand, edibles, some people like them, some people don't to a certain extent. So I definitely get that. I work with preschoolers, whatever works, totally. Yeah. And so how we're taking attendance is you will say goodbye in the chat. Liz is going to send out the link for here. Yep, she's right on it. Send out the link for the post test. Of course, it's not like graded or anything, but it will give you, that attendance, and we'll send out that certificate. And we thank you for, joining these Zooms in these unprecedented times. So thank you guys for joining. Hopefully you can take something away from this. If you have any questions, I'll stay for a few minutes.